A new class action lawsuit is accusing another Medicare insurer of using AI to deny care. Now, this suit claims that Humana has been using an AI algorithm that systematically denies care to seniors that is recommended by their doctors. This development is a part of a growing scrutiny around how insurers are using artificial intelligence tools to make decision coverage. Joining us now to talk more about this and give us more insight on this is Mike Desjadon. I think I said that right, Mike. He is the CEO.
Close enough, yeah.
He is the CEO of Anomaly, a company focused on healthcare, billing, and payments that also uses AI. Mike, thank you for joining us tonight.
Thank you, Kelsey. I appreciate being here.
Well, as someone who works with AI, can you kind of give us more insight into what is being done by insurers like Humana?
Yeah, I think we've read the lawsuits now, and I think it's there's a simple explanation to probably a very complicated thing going on behind the scenes, and that is they're trying to make a lot of decisions and spend less money doing it, and as a result, seniors aren't getting the care that they need. And I think if you're the average senior, or really any of us that have insurance from any insurers, whenever your care gets denied, it's a real challenge. But if you think about it, you at least have kind of the thought that maybe there's a person behind the scenes making a thumbs up, thumbs down call on whether or not you're going to get care. But when, it's technology and an algorithm, it seems, somehow, I don't know, a little bit more disconcerting.
Well, do you think that AI denies coverage at a greater rate?
Yeah, there's no doubt that it denies coverage at a greater rate. It just sees more information. I think it's able to look at more of the patients, look at more of the care that they're getting. And I think the whole reason people use AI is it can do more work faster, than the average person can. So, that's essentially why you use it. That's why we use it at the provider and the health system side, really to try to keep up. I think the doctors and the hospitals are really struggling to keep up with what the insurance companies are doing. So that's what we utilize AI for the very same reason.
Well, can you tell us more about your company's use of AI when it comes to the healthcare sphere? Can using this technology be good for patients?
Yeah, absolutely. Well, I think, we all have health insurance, or at least, most of us in this country have health insurance, whether it's provided by the government or provided by a commercial insurer. But really, I don't know about you, but most people really have no idea what's covered. I do this for a living, and my wife and I just had a baby, and, some of the bills were paid and some of them weren't. And it's really difficult to unpack. And, the average hospital or doctor's office, whose margins are shrinking every day, have the same problem. So what we utilize AI for is to try to figure out what's going to happen at the insurance company side. So, if you think about the case of Humana or United or any of these insurance companies that are using AI, it's one level more difficult, really, to understand what they might do when they get information. Because it's not necessarily humans making the decision. So what we use AI for is try to make sense of that and to give the information to the doctor so they can, fix things right at the front end so people get the care that they need.
We also know that Humana and United Health, they're both facing lawsuits right now connected to their use of AI. What do you think the outcome is going to be?
It's a great question. Honestly, I don't know. I know you see hearings on the Hill every single day talking about this. As a country, we're really grappling with what to do about AI and really how to regulate it. We know from a business standpoint, it's going to take off. It's the internet come round again. So it's definitely here. It's here to stay, and it's only going to grow. I think for our seniors, we really need to get a handle on it, because I think, it's one thing for me who pays for healthcare insurance, to get a denial and not know what's going on. But, when we think about Medicare Advantage and what's being alleged inside these companies, these are tax dollars, that are being given from the government, to these commercial insurers that are publicly traded companies, in the hope that they'll provide it, to these seniors in the form of good care with better outcomes. So lots of promise. I hope there's delivery. I guess, the good side of this is you do see hearings on the Hill every day. And these seniors do have recourse. I think, for me, if I were to call my insurer about a denied bill, I might be, left on hold for quite some time. But, if you're somebody, covered under Medicare, you call your senator, call your congressperson. These are tax dollars, and there's a great deal of scrutiny on this.
AI is really changing everything. Mike Desjadon, thank you so much for coming on the show tonight.
Thank you for having me, Kelsey.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.